Hi everyone, Dr. Sunil Dhand. 2 questions that you should ask your physician if you want to know the true benefits of any medical therapeutic or other intervention. These are not asked anywhere nearly enough, and no doctor should mind being asked these questions because they are core concepts in evidence-based medicine, which should be what we're all about. The first question is, what is the number needed to treat of this particular intervention? And the second question is, what is the absolute risk reduction? This information should always be available from the initial clinical trials and published studies. For every therapeutic or other intervention out there, it will always be available because, again, they are core statistical concepts. They may sound very complicated and scientific, but let me tell you in a nutshell what they actually mean. Number needed to treat is a concept we use to determine how many people need to be treated with a particular therapeutic or other intervention in order to obtain a benefit. So ideally, you want the number needed to treat to be 1, which means that everybody who receives a therapeutic will benefit. But this is not always the case. Sometimes it's 1 in 2, sometimes it's 1 in 10, 1 in 20, or it may even be less, 1 in 50 or 1 in every 100. But by asking this question and getting an answer, you will get a clearer picture of your chances of success. Don't assume the number needed to treat is 1. The second question, absolute risk reduction, is an absolutely critical concept in statistical analysis. Now, there are actually 2 concepts, relative risk reduction and absolute risk reduction. Relative risk reduction can make things sound much more impressive than they are. Let me give you an example. You may say that there is a relative risk reduction of 50%, and that sounds amazing. But when you actually dive into the numbers, what that actually means is you went down from 2 in every 10,000 people affected to 1 in every 10,000 people. That's what 50% means, when 9,998 people were not going to have anything happen to them anyway or experience any benefit. When you use absolute risk reduction, it takes into account the total number, so you get a fraction of a percentage that doesn't sound anywhere nearly as impressive. Surprise, surprise, the publishers of a study or anyone who will benefit financially from any particular intervention, whether it's a therapeutic or anything else, will always push relative risk reduction. But absolute risk reduction is really important to know, and it can also be used the other way around. You can say that there is a double risk of something happening, and it sounds horrible, or 100% increase. But again, what this means is you went from 1 in every 10,000 to 2 in every 10,000. That was it. 9,998 people were not going to be affected anyway. So you can see how these 2 questions will really give you a clearer picture of what's going on and your chances of success. And again, no doctor should mind being asked these questions. Any doctor who does mind isn't worth their salt. A doctor shouldn't have a tantrum or get angry when they're asked these questions. That's unprofessional behavior. Again, I actually relish being asked these questions, and of course, I don't often know the answers, and I simply tell my patients, well, let me check the study results and get back to you. But our patients deserve to know the full picture of their chances of success and the true benefits of any therapeutic that we are administering, and it is our duty to provide that information. I know being a doctor is a very tough job. I practice at the front lines myself, but it is easy to get stuck in protocols and to routinely prescribe things when we don't know ourselves the true benefits or we forget them. So this takes us back to evidence-based medicine. If you are a patient then and you have any questions about a particular medical therapeutic, especially if you're not in a life or death situation and you really want to know what's going on and how effective the intervention is going to be, please ask those 2 questions. What is the number needed to treat, and what is the absolute risk reduction? These 2 concepts form the basis of evidence-based medicine and truly critically analyzing what we do and getting a clear picture of benefits. Thanks everybody for listening. Let me know your thoughts down below. Dr. Sunil Dhand. Hit the subscribe button for more similar videos on my Real Medicine and Health Science channel. You can also follow me on my news channel. The link is down below. We will speak again very soon.